In this roundup of the week, the World Health Organization savages Sweden for believing in herd immunity. The world begins to relax lockdown, but sees early signs of a second spike. And Extinction Rebellion is full of rage that governments may not simply allow the air industry to die in a ditch like a dog. My name's Mallen Baker. This is the Mallen Baker Show for Changemakers. Welcome back to the slightly weird reality TV show that is 2020. I hope you're well and dodging the virus. If you value the independent, non-ideological, fact-focused service that this channel provides, you could consider supporting it on Patreon. Just a little support for when YouTube decides, as it so often does, to demonetize videos for talking about controversial topics or opinions. Just a couple of weeks ago, the WHO was musing out loud whether the post-lockdown world might be well advised to follow the advantage of Sweden. Well, that was then. This is now. And this week, the organisation slated the idea of herd immunity, and it was widely taken as a thinly veiled potshot at Sweden as it did so. Sweden has suggested that Stockholm might reach herd immunity status soon, although it's fair to say this is a seriously open question, as we don't really know for sure if you even gain future immunity once you've been infected. The WHO's Executive Director of Health Emergencies, Mike Ryan, said this: "The idea that, well, maybe countries who had lax measures and haven't done anything will all of a sudden magically reach some herd immunity, and so what if we lose a few old people along the way? This is a really dangerous calculation." He said that the concept of herd immunity, when enough of the population become immune to a disease so it ceases to be able to spread, is one that's used to talk about levels of vaccination. He said the idea of pursuing herd immunity through simply letting people catch the disease is a recipe for seeing a lot of people dying. It is only fair to point out that the Swedish government has said that it's not deliberately following a herd immunity strategy, but certainly some have argued for it. The argument is straightforward and not necessarily as callous as Mike Ryan suggests, and it goes like this. Almost no children, vanishingly small numbers, are affected by this disease. Even with the revelation that a few seem to develop some sort of inflammatory response, possibly as a delayed reaction to being infected, the numbers are still tiny. And likewise, although the numbers are slightly higher, really extremely low percentages of fit and healthy younger people, anyone under the age of 50, are at risk of dying from coronavirus. If you allowed all those people to get on with life unhindered and you put all of your effort instead into sheltering the most vulnerable, you could see the virus go relatively quickly through the population with little harm. In the UK, that would be around 65% of the total. And that's with a rather low cut-off of age 50. You could probably push that another 10 years. By so doing, you could perhaps achieve that level of herd immunity that would enable the vulnerable to then emerge back into the world safely. Instead, what we've done is we've shut down schools, shut down everything. And in the midst of logistical nightmare that's entailed with doing all of that, we've grandly failed to protect the most vulnerable, especially in care homes. Now, partly it comes down to what percentage of the population would be needed to achieve herd immunity. Epidemiologists traditionally suggest around 60 to 70%. Neil Ferguson's report in the UK estimated that relying on herd immunity could result in 81% of the population becoming infected over a 2-month period, leading to health systems becoming overwhelmed and many more deaths. The model underpinning such estimates, by the way, were described this week by Graham Medley, who sits on the UK Government's Scientific Advisory Group for Emergencies, as educated guesswork. And that's even without the bugs in the code that we discussed last week. That educated guesswork, and you do need to have something to work from, assumes the virus has the same attack rate at 80% as does the flu, which obviously we don't know whether that's the case or not. Sweden's public health agency has estimated that about a quarter of the population of Stockholm might have had the disease, which is obviously way short of that. According to that theory, Sweden's no lockdown policy should have the country still firmly in the grip of an exponential increase in cases. But that's not what we're seeing in practice. Stockholm University mathematician Tom Britton calculated that given behavioural changes Swedes have made 40% immunity in Stockholm could be sufficient, and that could happen by mid-June. The health authority tested for antibodies and as a result estimated that 17% of the Stockholm population would have been infected by the 11th of April, rising to 26% by May the 1st. But the rate of new cases stopped increasing by the 11th of April, as did net hospital admissions, and both have fallen significantly in recent weeks, which implies that herd immunity started to become an influential factor at a much lower level. And that kind of makes sense, because it's not something that suddenly gets turned on like a switch. The effect builds incrementally. One paper, published as a preprint, so not yet peer-reviewed, suggests that the percentage needed is affected by the presence of individuals who are more resistant to infection. The people that are most susceptible, naturally enough, get infected earlier, and the combination of the now immune survivors of that group with the individuals who are less susceptible in the first place means that the herd immunity threshold is reached more quickly. If that's correct, then it would explain why the growth rates in Stockholm have not veered into the catastrophic territory predicted by some and still being brandished at them by the WHO. We should be a little cautious because we have a tendency to be quick to believe things that we'd really like to believe would be the case before the weight of evidence fully justifies it. And people are doing that all over the place on this issue, depending on their preferences. But it might give some hope to the countries that have seen the worst infection rates to date, that the gradual relaxation of lockdown may see less of a resurgence than people fear. We're starting to get some more useful data. Spain, one of the countries that's had the highest death rates, tested 70,000 people at random to see which had antibodies showing that they'd had the disease at some point in the last few months. And it turned out it was 5%, which makes 2.3 million people. Now that's a lot of people, but obviously 5% is nowhere near what you would see for herd immunity. That's not the end of the story though, because the question is, what is the position in the areas of high population density? In Sweden, it's really Stockholm that's where the majority of the infections have occurred. In the Madrid region of Spain, the figure is 11.3%. Presumably much of that is in the city itself. Some way behind Sweden, but a lot closer than that national average would suggest. In the UK, a study looked at how many people are currently infected. They surveyed 11,000 people from over 5,000 households and came up with a figure of around 0.27% of the population, 150,000 people. These results were not broken down by geographical area, so it doesn't tell us about the likely situation in London, which has been the biggest centre of infections. There, we don't know what the figures look like in relation to any potential localised herd immunity effect, but it's surely going to be at least in line with Spain, and perhaps because of a greater population density in London, even ahead of that. While ironically, the countries that did the best job in preventing initial infections, such as Germany, may find that any relaxation has a more negative impact because they're a lot further away from that herd immunity level. Because it's not obvious there's an alternative strategy, whatever the WHO thinks, unless you're exceptionally well placed in the way that New Zealand is. Some people have been suggesting, if only Boris Johnson could have been the impressive leader that Jacinda Ardern is, Britain could have been like New Zealand. Ardern did an impressive job of being the most vigorous and early exponent of the lockdown approach, and all credit to her for that. But New Zealand is also a physically remote island with a 5 million population that's well spread out, which has a strong trust for its government, so it was able to implement early and get good compliance, and it was able very effectively to shut down its borders. And it may well turn out to be successful in completely eradicating the virus from its territory, which is the most successful outcome you could achieve for the lockdown approach. The Rolls-Royce standard. Great. But now what? Unless a vaccine magically appears well ahead of the expected timeline, the evidence seems to be this virus ain't going away anywhere in the rest of the world. So the only way New Zealand can remain virus-free is to remain permanently isolated. Maybe it will achieve an exclusive travel arrangement with Australia. Maybe New Zealand is a wealthy enough country that it can do that. I think about 6% of its GDP depends on tourism. Maybe it can lose that without too much pain. Maybe. I bet there's quite a bit of pain involved, but maybe less than the alternative. Almost no other countries are in a similar position. So Germany did a fab job in locking down, but gradually reopening means that the number of infections will go up. Because why wouldn't it? And that, of course, is exactly what we've seen this week, with some states now considering applying an emergency brake and reintroducing lockdown measures to prevent a second wave of infections. But that may not be easy, because although some leaders like Angela Merkel get admired by those abroad for their robust action, of course every leader gets attacked inside their own country. And there have been plenty of people arguing that the lockdown was an overreaction. This week, one advisor to the German government was sacked when they circulated a report calling the virus a false alarm and slamming the government for the impact of its lockdown. This all happened against the backdrop of increasing numbers of Germans flouting the existing rules as they decided that they'd had enough. So you shouldn't simply assume that slamming the brakes back on is an easy thing to do, politically, wherever you are. But even if you can lock back down, that just raises the question, how long are you going to do that? Is it really just that you're going to lock down, watch the numbers go down, and then think you can relax lockdown slowly enough that the virus won't notice, will get bored and go away? Because that's not how it works. The WHO praised Germany and South Korea, suggesting that well-implemented contact tracing was what made the difference. Do they make enough of a difference to just get you out the other side, or is it really still a short-term containment tactic? Can you really contact trace your way to elimination of the virus? Seems unlikely, at least in any country that expects to preserve some degree of freedom for its citizens. Now maybe this will be some salvation for the British government, which is one of those countries that has been the hardest hit, because it might at least suggest that relaxing lockdown won't see a massive increase, just a continuation of where we are now. The UK and Sweden have followed a similar curve, which the critics have been using as a stick to beat the British government with. It may well turn out to be the thing that saves us. Again, let's not jump to conclusions, but maybe. Last week I wondered aloud why it was that the infection rate and the death rate in the UK had remained so stubbornly high. I mean, I rather imagined it was probably because people weren't really sticking to the rules, because if there had been, there should have been a steeper decline. But how would you ever know? Well, I suppose you could run an anonymous survey, and that's what one market research agency, Decision Technology, did today. 29% of Britons admitted to leaving the house for non-essential reasons, and 35% said that they hadn't always kept the 2 metres rule. A separate survey by the University of Sheffield found that more than half of young men admitted that they'd taken actions in breach of the lockdowns during the recent period, along with a quarter of young women admitting the same. And the same phenomenon is surely at work in the revelation that rooked Andrew Cuomo, governor of New York, when it turned out that the majority of people who got new infections there were people who were staying at home, not people who'd caught it on public transport or essential workers. Ironically, that led certain ideological lockdown opponents to say, see, lockdown doesn't work. Of course, what actually doesn't work is pretending to lock down and then doing whatever you want to do on the quiet. There are certainly good arguments as to why the lockdown approaches of various countries might be the wrong policy. But ultimately, if your country goes that way, then you should probably accept that a well-executed but flawed policy is probably better than one that's not allowed to work by being undermined. If you think full lockdowns do more damage to the economy than's necessary, refusing to actually lock down just guarantees that the numbers will stay high, and therefore the government will feel the need to extend the lockdown longer than it otherwise might have. However, what any of us think about such things is pretty irrelevant, because policy doesn't exist in a vacuum. It has to be related to the propensity of any given population to actually respect it. And therefore it is what it is. What we have is a series of parallel social experiments taking place across the world. You can moralise and judge people if you like, and that's one of the variables that can influence the outcomes. Let's consider what happens to make some countries more successful than others at lockdown. The variables, it seems to me, are surely these. 1. The national character of the country and the amount of discipline the majority of citizens will be able to bring to bear to restrictions that people find irksome. 2. The degree of authoritarian enforcement that governments feel they're able to bring to bear to coerce compliance. 3. A degree of social peer pressure citizens will apply to each other to shame them into compliance. 4, the clarity of communication from governments as to what has to be done and why, leading to societal buy-in. 5, the degree to which dissenting voices are amplified and heard, arguing against the policy. I think those are probably the main variables. Did I miss anything? If I were rating the UK, I'd say the national character of the country and willingness to accept discipline was moderate. Degree of authoritarian enforcement is low. We get tremendously outraged by police officers, even slightly pushing outside the principle of policing by consent. There's a fair degree of social peer pressure. The police have received no fewer than 200,000 calls from the public snitching on their non-compliant neighbours. Clarity from the government, expressed in terms of consistency and communication generally, has been pretty poor. And 5, the dissenting voices haven't been much of a factor, since the most powerful ones with the biggest platforms have been arguing lockdown should have been sooner and more sweeping, not the reverse. So in the UK's case, since the nation would not have tolerated more authoritarian enforcement, the key variable has been consistency and clarity of government action and message. But we watched some of the better performing countries with interest. Germany, for instance, which had outperformed many of its peers, began its lockdown release last week and has seen significant uptick in new infection cases, as has South Korea. Its relaxation saw a spike in new cases, particularly focused on a cluster of nightclubs in Seoul. But the government held off on re-establishing social distancing measures until it sees what happens next. And that's surely a reflection of the fact that even those governments that were quick to act in the first place will be under a lot of pressure not to go backwards once they've started to open up. So at some point, do we begin simply to change attitudes? Do we decide that life entails a bit more risk than it used to? We all end up settling on herd immunity by default because, perhaps like it or not, it's actually the only viable strategy. And if we do, all just settle down to a new normal, which means we do all the things we used to do but just more carefully, well, some people are not going to be happy at all. Some people are depending on the severity of the crisis being sufficient to bring creative destruction upon the heads of people that they don't like. According to the Times newspaper, leaders of Extinction Rebellion have threatened the UK's Labour Party with cyber attacks for supporting an aviation industry bailout. Under the headline, "Let Airlines Fail or Else," say eco-activists, the Times said that the group sent a letter to Jim McMahon, the Shadow Transport Secretary, saying it would target the party with direct action protest if it persists in its calls for the government to save Virgin Atlantic from collapse, and hence to save the jobs of over 3,000 employees, by the way. Rupert Reed, one of the signatories, told The Times that the group was looking at ways of causing the party difficulties digitally, as well as physical distance actions at the party's headquarters. Apparently, Reed suggested there was a sense of rage amongst the campaigners. You can see in this the assumption campaigners have been making that the Covid-19 pandemic will give them a huge leap forward in their ambition by bringing down the entire aviation industry. A delusion that has probably been supported by initial government reluctance to bail out the airlines. So having talked themselves into the belief that this much favoured scenario is just about to come to pass, they've nowhere to go but blind rage, because obviously the government's not going to let that happen, and no reasonable mainstream party is going to join them in wanting it to happen. You only have to look at what happened the moment Boris Johnson suggested that although arrivals into the UK would be required to quarantine for 14 days, it was stated that arrivals from France would be exempt. Large numbers of people started immediately looking into the possibility of travel to France for a holiday. Human beings insist on being able to travel. If Extinction Rebellion can't cope with the idea of a vision for a carbon-free future where people get what they want, then they will be left to rage on the sidelines. And so they should. Maybe it was the Times sub-editor who put the phrase "let the airlines fail or else" into the story, but it's not an inaccurate summary of their position. Do as they say, or they will attack you, digitally and physically in terms of disruption. And they get all offended when they're put onto lists of terrorist groups because they're committed in principle to non-violence, but it is the logic of their approach. We're not here to persuade you, we're going to demand you do what we want. Actions that will have devastating consequences for hundreds of thousands of people, and if you don't, we will find ways to non-violently hurt you. Nobody should mistake their approach, trying to reduce emissions by devastating industries in dramatic and destructive ways, with effective action to reduce carbon emissions. There are lots of people talking about how we build back better, but they're talking about how we build back, not how we embrace the devastation and make it permanent, which may not be what the protesters think they're advocating, but it is the inevitable consequence of the sort of knee-jerk response that they're bringing to the party right now. The government released a public attitudes tracker this week that showed the government still has further to go simply in bringing people along with its own programme for net zero carbon by 2050. Extinction Rebellion may think that's a pathetically low ambition, even though it's more radical than any put forward by a UK government in history, but the public aren't with them. The survey showed that only 35% of the public have any awareness of the concept of net zero. That said, the percentage of people who continue to be concerned about climate change has remained high at 76%, just down by 4% in the face of a pandemic. Just 2% of the UK public say that they don't believe climate change is happening. Given that the government hasn't really done much of a sales job on its net zero approach, it's not surprising that people remain confused about a number of things. 82% of people continue to support the move towards renewable energy, but support for nuclear energy, seen as a key part of the zero carbon baseload supply, has dropped to 32%. 80% of people claim to give a fair amount of thought about saving energy in their homes. Giving thought to something shouldn't be confused with actually doing something, obviously. So just time quickly for one thing that I like and one thing that I don't. One thing I like, apparently coral reefs may be able to survive rising temperatures better than we feared with a little bit of help. Scientists basically took algae from reefs and trained them to cope with higher temperatures by exposing them in a laboratory for 4 years to a temperature of 31 degrees centigrade. That's 3 to 4 degrees C above what they would normally experience and comparable to the water temperature during Great Barrier Reef bleaching effects, bearing in mind that temperatures may not be the only reason for those bleachings. When they were reintroduced into coral larvae, they were found to have adapted to become more tolerant of heat, and they were able to share this benefit with the coral. You can add that to naturally changing effects, where some more heat-resistant corals become more numerous at the expense of some of the more heat-sensitive ones. But there are important corals in the mix that don't deal well with the heat, so the initiative could make a real difference. When I talk about the real change makers working across the world in all sorts of places, making more of a difference to the problems that we have to solve than those who think it's all about holding up a placard, these are the sorts of people that I'm talking about. And then the thing that I don't like. We saw a story this week about how health workers in 11 countries have to avoid wearing their uniforms in public for fear of being attacked. A nurse in the Philippines was hit in the face with bleach. Workers in India had stones thrown at them. Even in Australia, health workers in uniform have been spat at and assaulted. Can someone explain this to me? I mean, I can understand certain types of idiot behaviour. Lots of people do bad things when they feel their identity is threatened or when they're going through hard times or whatever. I completely condemn, but can also understand someone who, for instance, attacks people of a nationality that they blame for the virus happening. They're wrong to do it, there's no excuse for it, but I understand what they think their motivation is when they do it. Can someone explain to me what the heck makes even idiots think that attacking health workers in a pandemic is something that you would want to do? Doing harm to the people who next week might be the ones you want to save your life. Why? Why? Do they think doctors and nurses must be infected and shouldn't be allowed to step outside their own hospital? In which case, why would physically assaulting them an action that would make you more likely to catch the virus? Why would that be the go-to plan? However much I try to channel my inner stupid to get an insight into the mindset that creates this behaviour, I find myself unequal to the task. Does David Icke put it out that all health workers are lizard people? I mean, seriously, what in the name of everything that's holy is all of this about? If you're watching this and you're a health worker, I trust you have an overwhelming show of support in your life to offset this sort of random moron behaviour, because every sensible human being appreciates what you're doing and wants you to know it. That's all for this week. Hope you're finding a way to make a difference to your community, your country, or even just your family and your friends in these lively times. My name is Mallen Baker. This is the Mallen Baker Show.